Having clogged ears can be uncomfortable and may muffle your hearing. When this happens, popping your ears may help. Popping your ears is generally safe. It usually requires little more than moving your mouth muscles. Regardless of the technique you try, be gentle. If your symptoms worsen, stop trying to pop your ears and consult your doctor. If you try to unclog your ears with over-the-counter OTC or prescription medications, avoid prolonged use. If your symptoms persist, talk to your doctor. So, there are several techniques you can try to unclog or pop your ears. 1. Swallowing. When you swallow, your muscles automatically work to open the eustachian tube. This tube connects the middle ear to the back of your nose. Chewing gum or sucking on hard candy can also help activate this response. 2. Yawning. Yawning also helps open the eustachian tube. If you can't yawn on cue, try a fake yawn. Open your mouth as wide as it will go while breathing in and out. This may have the same result. Try yawning every few minutes until your ears pop. 3. Valsalva maneuver. Pinch your nostrils closed with your fingers. Try to keep your cheeks neutral, or pulled in, rather than puffed out. Next, blow air gently through your nostrils. This generates pressure in the back of the nose, which may help open the eustachian tube. 4. Toynbee maneuver. For this technique, pinch your nostrils closed with your fingers while swallowing. Some research-trusted source indicates that the Toynbee maneuver is just as effective as the Valsalva maneuver, though results differ from person to person. You may want to try both to determine which method works best for you. 5. Applying a warm washcloth. Holding a warm washcloth or covered heating pad against the ear can help eliminate congestion and open the eustachian tube. This method can also feel soothing. It may be most effective if you have clogged ears due to a cold, the flu, or allergies. 6. Nasal decongestants. Unclogging your nasal passageways can help with clogged ears. If you use an OTC nasal decongestant, make sure to follow the directions carefully. You may want to try the Valsalva or Toynbee maneuver after using a decongestant. 7. Nasal corticosteroids. There are many OTC nasal steroids you can try. Nasal steroids may help unclog your ears by reducing the amount of inflammation in the nasal passages. This can help air move more freely through the eustachian tube, equalizing the pressure in your ears. What else causes ear popping? Sometimes your ears may clog and unclog themselves naturally. This usually happens due to changes in the surrounding air pressure. If you're climbing to a high altitude, for example, flying on an airplane or driving up a high mountain range, your ears may pop as they adjust to the air pressure around you. Precautions. If you can't pop or unclog your ears 2 weeks or longer, or are experiencing pain in the ear, consult your doctor. Your doctor can rule out any underlying conditions that may be causing this sensation. These may include adenoids, sinus or ear infection, allergies, earwax buildup, common cold, temporomandibular joint disorders (TMJ). A clogged eardrum can sometimes bulge to the bursting point, leading to a perforated eardrum. This may occur during activities involving rapid pressure changes, such as air travel or scuba diving. A perforated eardrum requires a doctor's care. This condition typically dissipates within 2 weeks. Some cases may require an eardrum patch or surgery.